Hello everyone, my name is Dr. Asma, and the purpose of making this video today is about to discuss a very important health issue, which is sudden death. And actually what made me think about this problem was a devastating news about a young doctor who passed away following a sudden cause, and which is really upsetting. And anyone who comes across such news, hears about it, is makes life very stressful. And a few things that we can know, and we can actually help ourselves to actually stratify the risks and see why what are the main causes of sudden death in healthy individuals, especially young adults. The evidence suggests after trauma and stroke, the most important causes are sudden cardiac causes, like sudden cardiac arrest. And in today's discussion, I will briefly describe. It's a very vast topic, but I will briefly describe about a few things which are related to this problem. So who are the high risk individuals who can have sudden cardiac arrest? So how we can identify the risks basically. And then what are the symptoms, if any? Sometimes there can be no symptoms, but at least we should be aware of the symptoms. And leading to that, what are the causes of sudden cardiac deaths, and then how we can prevent and how we can manage them as further. So first of all, looking at who are the high risk individuals. So a very important thing, even if we say that it is very rare for a young healthy adult to have a cardiac problem, but if you look into family history, if there is any family history of a very young person or a child or a teenager who has been affected, suddenly collapsed and then did not revive, you have to think of family history of any reason which has made the heart to collapse. I'll come to the causes in a bit. And then also, if there is family history of high cholesterol, of course not everyone is aware of what blood cholesterol levels are, but a hint in the history is that if you have any family history, any person known in your family who has had heart attacks before the age of 50 years, especially if they are male individuals, and also any children who have suffered, who have had any cardiac surgeries, or who have known cardiac problems. So these are the main risk factors. Also, if yourself, or you can see anyone in the family who has like a fat collection in their skin, so what it looks like is like beneath the eyes or any part of the skin you have swelling, and you can feel that these are the fat granules in the skin, which actually indicates that the cholesterol is very high. So these are broadly the individuals who are at higher risk of having cardiac problem. Right, what can be the symptoms? Unfortunately, many people will not have any symptoms, so it just comes as sudden, and it is devastating, as in many cases it is. But a few symptoms to look at is if there are sudden collapses, means that there is no warning, you're absolutely fine, and suddenly there is a drop in the you black out, and there's consciousness fall, and it's just you become unconscious. So that sudden drop of consciousness, or call it unawareness or collapses, they are indicators of a cardiac cause. Why? Because what's happening is there is some problem in the cardiac rhythm, and the heart pumping, it just stops for a while and the body shuts down. So there is no warning, unlike other problems, like when you have seizures or epilepsy, you feel some kind of tightness, you feel some kind of aura, we call it. You feel that it is coming, and gradually that takes you over, and you can have abnormal movements, or you can have even seizures. So that apart, for cardiac illnesses, it is no warning collapses. Other things are chest pain. Very unlikely young people will have chest pain, but if it is a central boring chest pain which is related to breathlessness, I think take it very seriously. Other thing is that even if you are at rest, you feel a feeling of heart racing. So there is some problem in the heart conduction, like how fast the heart beats. It has to be a regular rhythm, which we call a sinus rhythm. And if there is a problem in the heart rhythm, there can be a feeling of missed beat, or there can be a feeling of heart racing without you being exerting or exercising. And also breathlessness without any cause, or as I said, if you feel you're fainting. So these are major causes. Most of these symptoms might not be related to cardiac causes. They can just be related to infections or chest problems or trauma or anything. But in the sequence of events, if you have family history or you have had any symptoms of these sorts, this is important to seek medical advice. So now I come to the causes. Very simply, I'll not go in details. There are three main causes. Either your heart is not formed normally, or even if it is formed normally, its muscles are stretched or under stress. These are called cardiomyopathies. Cardiomyopathies, they can be inherited, just if they can come from your family, or they can be caused by viral infections or other causes or metabolic causes. So this basically means that the heart is not pumping enough, the muscle is itself weak. So that is one thing. Then is a rhythm disorder, which is very important, and that is where we collect all the data, we collect all the symptoms. Is that heart has a rhythm, which is a sinus rhythm. So you have a P wave, and then there is a QRST complex. So there has to be a regular heart rate, like we have like 70 to 80 around normal heart rate. In those conditions, the heart doesn't beat normally. It can misbeat, it can beat fast, it can beat with abnormal complexes. So these are basically problem with the rhythms, and they can be diagnosed with an ECG or a long ECG over 24 hours. So either it's a problem with the heart muscle, either is a problem with the heart conduction or a heart rhythm, or it can be a problem with the structure of heart itself, if the heart is abnormally made, as we see in children. There is another thing which is an important but can be very subtle. It can be very asymptomatic, which is high cholesterol. So there's something called familial hypercholesterolemia, where the blood levels of cholesterol are raised, and they are raised from the beginning of your life, and they cause deposition of fats in the coronary arteries, which supply the blood vessels. I'm talking a lot of medical jargons, but basically the cholesterol blocks the heart vessels, and then the heart stops working. So I think these are the main causes, and if you relate these causes to the symptoms, you can understand that most of these things might not cause any symptom. Now I'm coming to, so now we understand who are the high risk individuals, how it can present, and what are the main causes. Now how can we prevent these problems? So I think if we can identify the high risk individual, the most important thing is to do an ECG, echo, and a blood test for cholesterol. These are at least minimal things that you would seek from medical services to have a screening of a general thing. I don't think so that every person, if you're really anxious, probably it might help you to think that things are right, but if you think that there are some symptoms, then these are important things. And of course, once the test tell you something, you have to address the cause. Also, generally looking, like if high, increased body weight, obesity, high salt intake, high fat intake, less exercise, sedentary lifestyle, all these can contribute toward cardiac risk factors, even as a young individual. So always try to have a balanced diet with lots of greens, low salt, less fats, and maintain a healthy lifestyle with good exercise in a week, and try to be healthy. Now I want to tell you about what to do if something happens. This is called golden minutes rule. So if there is a witnessed collapse, if somebody collapses in front of your eyes, you have golden minutes to rescue. And these they say every minute lost to give a proper rescue is 10% decrease in the survival rate. So this is very important that we consider the time of reaction and don't panic. The important thing is that you call for help. So first thing is, if you think that that has happened, you have witnessed it, you have to ask somebody else to either call an ambulance, call somebody else, or grab you something. You need to shout for help and then approach with care. You have to be safe when you're approaching the person, and then see what is the condition. If he's really not responding, if really not breathing, then you have to start chest compression, the CPR. CPR is the cardiopulmonary resuscitation. Basically, the most important factor in chest CPR is how good you do the chest compression, how deep you are going inside the chest to basically work for your heart. Once the circulation starts working, the organs will receive some blood supply, some oxygen, and they will start reviving if it is a reversible cause. Of course, there are many reasons why people collapse, but if it was a cardiac collapse and the heart is resting in asystole, like it's not pumping and it's still, your chest compression and rescue breaths can save a life. There are other causes where your heart is fluttering. Basically, we call it arrhythmias or ventricular fibrillations, where your heart is fluttering and is actually moving but not pumping enough to supply to the body, and they can be reversed with cardiac shocks. So they involve defibrillators. Probably if they're not in the vicinity, don't think about it. But most important thing is obey the golden minutes rule, that call for help, call the ambulance, and if you're CPR trained, start chest compression, or seek any person who can actually deliver chest compressions. And then of course, when the ambulance arrive, they will take to the hospital and see what can be done and what were the reasons. So by and large, it is rare to happen in adults, but if it does happen, the important thing is that rescue is given in time. Also, for your own peace of mind, if you know anyone with this family history or these symptoms, it is important that you flag them up and ask them to have some basic tests like ECG, echo, and a blood cholesterol test from hospital, and they can extend it to genetics, they can extend it to many things, but at least this is the basic thing. So I think that it is very important for us to be prepared for unseen and unforeseen circumstances. And if this happens, God forbid, an important thing which can help your family is if you have any rescue numbers, any numbers that they can reach out, your children can reach out, your spouse can reach out to ask for help or to get further support. So write any near family members' phone numbers or rescue numbers on the fridge in the easy accessible place, so your family can actually help them at that stressful situation. I think it's a lot to take in, but as a whole it is rare, and if it happens, you have not to panic, but just keep yourself calm and do the rescue as much as you can. And generally in your life, if you see someone or you feel that these risk factors exist, then try to act on them and help in their management. I think that's really it. Thank you very much.